Hi, my name is Shandabi Coleman, and today we're going to talk a little bit about schizophrenia. Schizophrenia is a severe, chronic, and generally disabling brain and behavior disorder. It causes people to interpret reality a little bit differently. It's most accurately described as a psychosis, a type of illness that causes severe mental disturbances that disrupt normal thought, speech, and behavior. And let's talk a little bit about the signs and symptoms. Signs and symptoms start with schizophrenia usually starts between the ages of 16 and 30. In rare cases, children have schizophrenia too. The symptoms of schizophrenia fall into three categories. You have positive, negative, and cognitive. Positive signs or symptoms of psychotic behaviors not generally seen in healthy people. People with positive symptoms may lose touch with some aspects of reality. Some symptoms include hallucinations, delusions, thought disorders, usually or dysfunctional ways of thinking, movement disorders, or agitated body movements. And this is just a picture of some of the positive signs where the guy is saying, like, where are those voices coming from? I saw elephants under my bed. Maybe I am Jesus. The radio told me to free all the animals in the zoo. Those are just different signs, positive signs that they do use for like hallucination and different things like that. Some of the negative signs and symptoms are associated with disruptions to normal emotions and behaviors. Some of the symptoms include they can have a flat effect. That's just a reduced expression of emotions via their facial expression, their voice, or their voice tone. Reduced feelings of pleasure in everyday life. Difficulty beginning and sustaining activities. Reduced speaking. And this is just a picture of one of the negative signs where they're kind of just sitting there and the lady is maybe screaming at him and she's thinking that he's lazy because she's not understanding what's really going on with him. Cognitive symptoms, for some patients, the cognitive symptoms of schizophrenia are subtle, but for others they are more severe, and patients may notice changes in their memory or aspects in their thinking. Symptoms could include poor executive functioning, the ability to understand information and use it correctly, or to make decisions, trouble forcing or paying attention, trouble focusing, or paying attention, problems with working memory, the ability to use the information immediately after learning it. And this is just a picture of, it looks like they're going out of their mind and they're trying to think and they actually can't think because of the symptoms of the cognitive impairment. For causes, it's not really known what causes schizophrenia, but researchers believe that a combination of genetics and environment contributes to the developmental of the disorder. Basically, like the environment triggers the disorder. Problems with certain naturally occurring brain chemicals, including neurotransmitters called dopamine and glutamate, also may contribute to schizophrenia. Neuroimaging studies shows differences in the brain structure and central nervous system of people with schizophrenia. While researchers aren't certain about the significance of these changes, they support evidence that schizophrenia is a brain disease. Risk factors. Although the precise cause of schizophrenia isn't known, certain factors seem to increase the risk of developing or triggering schizophrenia. having a family history of schizophrenia, exposure to viruses, toxins, or malnutrition while in the womb, particularly in first and second trimester of pregnancy, increased immune system activities such as from inflammation or autoimmune diseases, older age of the father, taking mind-altering psychoactive or psychotropic drugs during teen years and young adulthood. And this is just a picture of age, genetics, and family history that affects schizophrenia. There could be complications if it's left untreated. It can result in severe emotional, behavioral, and health problems, as well as legal and financial problems that affect every area of life. Complications that schizophrenia may cause or be associated with may include, there could be suicide, any type of self-injury, anxieties, phobias, depression, abuse of alcohol, drugs, or prescription medications. They can have poverty, homelessness, family conflicts, inability to work or attend school, social isolation, health problems including those associated with antipsychotic medications, smoking, and poor lifestyle choices. They could be, a victim of aggressive behavior. Aggressive behavior, although is uncommon and typically related to the lack of treatment, substance misuse of a history of violence as well. And these are just pictures of a lady who's kind of confused and kind of really out of her mind, and there's a guy that's suicidal with a gun to his head. There's a self-mutilation, the self-cutting. There's a homeless guy in the picture, and then there's just a group of people and the guys in the background. Preparing for your appointment. If you're seeking help for someone with a mental illness, you may start seeing his or her family doctor or a general practitioner. However, in some cases, when you call to set up the appointment, you may be referred immediately to a psychiatrist. What you can do to prepare for the appointment, make a list of any symptoms that your loved one is experiencing, including any that may seem unrelated to the reason for the appointment. Key personal information, including any major stressors or recent life changes. Definitely medications, vitamins, herbs, and other supplements that he or she is taking, including the dosage. Questions to kind of ask the doctors. You want to go with your loved one to the appointment, getting the information firsthand. It'll help you know what you're facing and what you need to do for your loved one. For schizophrenia, some basic questions to ask the doctor include, what's likely causing the symptoms or the condition? The doctor is likely to ask a number of questions including, what are your loved one's symptoms and when did you first notice them? Have symptoms been continuous or just occasional? Has your loved one talked about suicide? And they may ask, how is your loved one functioning in their daily life or with their activities of daily living? So there's a couple of questions that the doctor may ask to try to get to the root of the problem. Any testing, screening, or any testing diagnostics, they can include lab tests, CBCs, other blood tests. They may help rule out conditions with similar symptoms. They can screen for alcohol and drugs. The doctor may also request imaging studies such as an MRI or a CT scan, psychological evaluation. A mental health provider will check the mental status by observing appearance and demeanor and asking different questions and asking about their thoughts and moods, delusions, hallucinations, if there's substance abuse, and potential for violence or suicide. To be diagnosed with schizophrenia, there's a certain criteria that you would actually have to meet. A person must meet all the criteria, like in the Diagnostic and Statistical Manual of Mental Disorders, the manual published by the American Psychiatric Association. It is used for healthcare providers to diagnose mental conditions. Diagnosis of schizophrenia involves ruling out other mental health disorders and determining that the symptoms aren't due to substance abuse, medication, or medical condition. In addition, a person must have at least 2 of the following symptoms most of the time during a 1-month period, with some level of disturbance being present over 6 months. They need to have delusions, hallucinations. There could be disorganized speech, indicating disorganized thinking. They can have extremely disorganized behavior, catatonic behavior, which can range from coma-like daze to bizarre hyperactive behavior. Negative symptoms, which relate to reduced ability or lack of ability to function normally. At least one symptom must be delusions, hallucinations, or disorganized speech. The person shows a significant decrease in the ability to work, attend school, or perform normal daily tasks most of the time. That's their activities of daily living. The American Psychiatric Association eliminated the previous subtypes of schizophrenia, which is paranoid, disorganized, catatonic, undifferentiated, and residual, because of poor reliability. These subtypes were shown to be valid and didn't help in determining which treatment might be best for the schizophrenic patient. Schizophrenia requires lifelong treatment. Even when symptoms have subsided, treatment with medication and psychosocial therapy can help manage the condition. During crisis periods of times of several symptoms, hospitalization may be necessary to ensure safety from their self and others, proper nutrition, adequate sleep, and basic hygiene. Medications are the cornerstone of schizophrenia treatment. However, because medications for schizophrenia can cause serious but rare side effects, people with schizophrenia may be reluctant to take them. Antipsychotic medications are the most commonly prescribed drugs to treat schizophrenia. They're thought to control symptoms by affecting the brain neurotransmitters and dopamine and serotonin. Willingness to cooperate with treatment may affect medication of choice. Someone who is resistant to taking medication constantly may need to be given injections instead of taking a pill. Someone who is agitated may need to be calmed initially with a benzodiazepine such as lorazepam, Ativan, which may be combined with an antipsychotic. These newer second generation medications are generally preferred because they pose a lower risk of serious side effects than do conventional medications. They include Abilify, Safaris, Clozaril, just a list of different medications that your doctor may prescribe for you. The first generation medications have frequent and potentially significant neurological side effects, including the possibility of developing a movement disorder, which is tardive dyskinesia. that may or may not be reversible. This group of medication includes the chlorpromazine. Sorry about that. The words are a little bit hard to pronounce. But there's a list of medicines here as well. The Halidol, just different medications there. These antipsychotics are often cheaper than newer counterparts, especially the generic versions of the drug, which can be an important consideration with long-term treatment when it's necessary. It can take several weeks after first starting a medication to notice an improvement in symptoms. In general, the goal of treatment with antipsychotic medication is to effectively control signs and symptoms of the lowest possible dosage. The psychiatrist may try different medications, different dosages, or combinations over time to achieve the desired result. Other medications may help, such as antidepressants and anti-anxiety medications. Psychosocial interventions. Once psychosis recedes, psychological and social and psychosocial interventions are important. In addition to continuing on medication, they can have individual therapy, just to kind of learn to cope with stress and identify early warning signs of relapse. They can have social skills training. This focuses on improving communication and social interactions. They can have family therapy, and it just kind of provides support and education to families dealing with schizophrenia. Vocational rehabilitation and supported employment. This just focuses on helping people with schizophrenia prepare for, different kind of jobs out in the community. Most individuals with schizophrenia require some form of daily living support. Many communities have programs to help people with schizophrenia with jobs, housing, self-help groups, crisis situations. A case manager or someone on the treatment team can actually help find different resources for the schizophrenic patient. With appropriate treatment, most people with schizophrenia can manage their condition. Coping with the mental disorder as serious as schizophrenia can be very challenging, both for the person and actually for the family as well too. Here are some ways to cope. You want to learn about schizophrenia. You want to get educated about it. You want to know about the condition, how to help motivate the person. You want them to stick to the treatment plan. You want to educate the friends and the family as well, to kind of just understand the condition and to show compassion for the person who has it. Then you want them to join support groups. Support groups with people with schizophrenia can help them reach out to other families facing similar challenges. Support groups may also help family and friends cope as well too. You want to stay focused on the goals, because managing schizophrenia is an ongoing process. Keeping treatment goals in mind can help the person with schizophrenia. They can stay motivated. You can help your loved one remember to take responsibility for managing their illness and working towards their goals. You want to learn relaxation and stress management. The person with schizophrenia and loved ones may benefit from stress relief techniques or stress reduction techniques. You can meditate. There's yoga and Tai Chi, and I also will add in exercise or joining some type of gym to help kind of relieve stress. There's no way, a sure way to prevent schizophrenia. However, early treatment may help get symptoms more under control before it becomes serious and get complicated. sticking with treatment with a treatment plan can help prevent relapses and worsening of the schizophrenia. In addition, researchers hope that learning more about the risk factors for schizophrenia may lead to an early diagnosis and treatment. Now we're going to look at a video that shows the experience of a psychotic episode as described by a schizophrenic.
Simulation of a psychotic episode in a patient with schizophrenia. The symptoms you will experience represent a compilation of a range of sensory occurrences as reported by actual patients.
Worthless.
He's waking up now.
Oh, the phone woke him up. Don't answer. They'll know who you are.
You're a waste of space.
Why are you so stupid?
A waste of our time.
Stupid. So stupid. Worthless. We hate you.
He's gonna pick up the phone.
They'll know if you lie.
Rain! It's
Something
rain!
wrong. Weather.
Sounds like pizza.
Poison.
Tommy. Pizza.
He's hanging up.
Do you hear me?
Don't eat. Out to get you.
Poison.
They know about you.
Cameras
Poison.
rolling when armed gunmen entered the convenience store on 14th Street. The suspects were described as medium in stature with a slightly youthful demeanor. Anyone with information about this incident is urged to contact
They know. They know about you.
And in other news, officials have closed the northbound
Time for meds. Don't do that.
due to a water main break. Repair crews are on the scene. Now here's a story out of Chicago from last night. Two men posing as maintenance workers nearly made it out of the Quick Bite convenience store with the store's ATM machine.
Make a
The
list.
suspects
Make
pulled
a
up the
longer
van,
list.
entered the store, asked the
You
customers
are
not to use the
ungrateful.
machine because
You're a
they were
waste of
followed.
space.
They
A
told
waste
the
of our
clerk that they were
time.
going to take the machine back to the
Get
shop.
on coffee now.
Don't drink it.
Sensing something
Stupid. So
suspicious, the clerk
stupid.
That
called
smells
the
awful.
guard.
Don't drink that coffee.
When the clerk told the men he had called police, the pair took off and left the machine.
Why are you so worthless?
So Scott, tell us how this weekend's weather is.
Weather. Something wrong.
You know what, Chuck? There's just no stopping the weekend weather. You hear that, worthless? Weather's coming to get
Something
you.
wrong.
Hey,
Weather.
what are you going to do about it, huh?
Something wrong. You have to stop it.
You're just going to sit around with your stupid mouth open and do nothing?
You have to stop it. It's the weather. It's here for
Now
us.
he has to answer the door.
It's here for us. Do something. Stay in.
Pizza!
Stay away from the
No,
door.
stop the weather. Protect us.
You
Pizza!
didn't order anything. No, don't answer. You're stupid to open that door. He has to open the door now.
Here you go.
Don't do it.
You'll be in trouble. Poison.
This is for you.
This is for you. He's working with them. He's part of the plot. This is for you. Shut the door. Shut it. Don't eat it. Poison. You're stupid to open. I hate you. We hate
Here's some
you.
items on today's activities calendar.
And you need some activities, especially when you're lazy and you sleep too much. Stop staring at me.
I know what you're thinking.
He knows. You can't stop
They're
it.
coming for you. You know that.
Part of the plot. Your mind.
It's because you're so ungrateful.
Don't eat it. Poison.
No, don't open
He
it.
has to open the box.
This is entirely your fault.
Don't eat it. Don't eat it. Poison. Poison.
They're here, and it's all your fault.
Oh.
No.
They know it's you. You're in
Don't
control.
open the
You
door.
hear that?
No, don't open it. Don't open it.
They're here, and it's all your fault.
You did it.
You should have used your mind to stop it.
Stop it. You have to take control.
Stop the door.
Hey, you alright in here? I called you. Why didn't you answer? I was like screaming, "It's Lorraine! It's Lorraine!" into the phone at the top of my lungs. What were you watching? Do you even remember? Did the pizza Oh! What happened here? Forget to take your medicine this morning. Well, you know it's not good to miss a dose. Well, it's not too late to take it now. Let's get back on track. And why are you standing here in the dark? It's a beautiful day outside. Let some sunlight in. You need to get outside and enjoy it.
Schizophrenia cannot be understood without understanding despair.